Moving on now to the vital structure allowing everything to work, the nerves. As well as initiation of movement and reflexes, the nerves create the senses of touch, sensitivity to temperature, and other senses allowing us to function safely and effectively. To start, we have the radial nerve. Deep to teres major, it runs under the clavicle, the collarbone, posteriorly through and under the lateral head of the triceps muscle. It then runs down and laterally under brachioradialis, at which point it splits and branches into the posterior interosseous nerve. It then runs through the supinator muscle. The more superficial branch of the radial nerve ends into the posterior radial aspect of the wrist and the hand. The radial nerve supplies all muscles in the posterior compartment of the arm and the forearm. It also innervates the whole of the back of the hand except the little finger. From the top we have the triceps, innervated from nerve roots C6 to 8, then brachioradialis from root C7, and supinator from roots C6 to 7. Oh, and also the anconeus muscle, innervated from roots 6 to 8. It's important to know nerve roots so we are able to identify what level is being tested with sensation and reflex tests in clinic. Moving to the anterior aspect of the arm, we have the median nerve. It runs under the clavicle, lateral to the brachial artery, and then under and along the medial side of the short head of biceps. It progresses through the cubital fossa on the anterior compartment of the elbow, and then under pronator teres. It then runs superficially to and along the flexor digitorum profundus muscle, and finally into the hand through the middle of the anterior aspect of the wrist. The median nerve also splits into the anterior interosseous nerve. It mainly innervates the pronator teres and quadratus muscles, all forearm flexors, and the thenar muscles at the base of the thumb. We then have the musculocutaneous nerve, branching from the median nerve. Again, on the anterior aspect of the upper arm, the most lateral branch. It runs deeply into the coracobrachialis muscle, under the short head of the biceps brachii. Then surfaces superficially to brachialis, remaining deep to the biceps. It lies between and innervates both the biceps and brachialis muscles, from nerve roots C5 to 6. The brachialis muscle is also innervated by a branch from the radial nerve, from C7 nerve root. And finally, a quick mention of the ulnar nerve. As the most medial branch, it runs medial to the biceps short head, median nerve, and the brachial artery. It descends down the upper arm into the medial intermuscular septum, mentioned earlier as an origin of the pronator teres muscle. It then passes posteriorly to the medial epicondyle, and then wraps anteriorly into the medial aspect of the forearm, running superficially to the flexor carpi ulnaris muscle. It innervates mainly the wrist flexors, and is the main cause of the funny bone sensation. When impacted on that medial posterior side of the elbow, it causes the fingers to flex and creates that numb, heavy feeling throughout the forearm and the hand. Okay, so thanks for watching, guys. If you enjoyed this video, give it a thumbs up. Any further questions or suggestions for future videos, comment below, and remember to subscribe for more videos.